WFM 91.7.
Thank you so much for tuning in and joining us right here on Women Radio WFM 91.7, which is Nigeria's first only radio station for women and their families. I hope you're feeling great today. I hope you're doing well. I hope you woke up feeling very, very energetic. Well, I can only hope that all of these good things are happening to you. But if not, well, you just have to find a way to pump yourself up and get going, okay? So just find something that makes you feel good, something that make your energy up there, and of course, just keep going. All right, it's a get better. All right, so it's 5 minutes after 10 right here on Women Radio WFM 91.7. My name is Rose Yusuf Kaiser, and you're welcome to the program Radio Doctor. Radio Doctor is your free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise on radio right here on Women Radio. Now, Radio Doctor comes to you Mondays through Fridays from 10 a.m. All right, today on Radio Doctor, we are looking at general health, and general health on Radio Doctor is supported by Geneth Pharmaceutical. All right, yes, like I said, my name is Rose Yusuf Kaiser, and today's Radio Doctor is Dr. Alozie Ndobuka, a medical director at St. Ives Family Hospital. Good morning, Dr. Ndobuka. How are you today?
Good morning. How are you?
I'm okay. How are you too?
I'm doing well. Thank you.
So how has the past week been for you?
Oh, it's been busy as usual. You know the life of a doctor.
Can you imagine?
Busy.
All right. So thank God you're here with us today. All right. So Dr. Ndobuka will be consulting and advising on aging and health. Okay. So when you think about aging, you think, yes, that is something that would happen to everybody. In fact, life is a circle. So at some point you were born, at some point you learned how to walk, at some point you became a teenager, at some point you finished school, you started working, and you got married. Now you're having your own kids. So you see that life is just going. And as the year go by, every day you get a little bit older. Whether you like it or not. Okay, so you must age. It's just part of it. Even some people that will say, okay, I think I can reduce my age by 3 years, by 10 years. You just go and do some paperwork, and before you know it, it will not still change the fact that you're getting old. Let me just tell you, just put that in the back of your mind. All of you that are refusing to get old, may don't be deceiving yourself. You are getting old. Somehow you're getting old. So today we're looking at aging and health, and we know that as we get older, sometimes we get to, if we don't, that's why most times when we come here, we say take care of yourself so that your body would actually serve you for a very long time, because there's a lot of illnesses that comes with getting old. Okay, if you don't get to take care of yourself, then you get to face all of these things, or some of them once you start getting really old and weak, when all your immune systems are telling you, well, we too are getting old, we too are getting there, so please follow us gently. So that's why we need to take care of ourselves. And today, Dr. Ndobuka will be consulting and advising on aging and health. All right, so like I said, today's Radio Doctor, General Health, is supported by Geneth Pharmaceutical. So our phone lines for today are 07000 917 917. Send us a text or a WhatsApp message on 070 317 56537. Those are the numbers to get in touch with us today. You can go to our social media platforms, Facebook, Instagram, X, and of course YouTube on WFM 917. Log on to our website www.wfm917.com. Download our mobile app WFM 917. You get to listen to us from any part of the world. And like I would always tell you, we love to be wherever you are. So please get to listen to us from anywhere you are. We are always right there with you. All right, so those are the ways you can get in touch with us this morning. So yes, let's go ahead and hear from Dr. Ndobuka on aging and health. All right, but before then,
give malaria a double punch of Protestanate and Ammonia Queen, an effective combination that Camosunate is anti-malaria therapy, and you will bounce back to life. Comes in 4 different packs for different age groups, below 1 year, 1 to 6 years, 7
Monsunate, effective anti-malaria for all ages. Marketed by Janet Pharmaceuticals Limited. If symptoms persist after 3 days, please see your doctor. Read the leaflet inside.
All right, you're welcome back to Women Radio WFM 91.7, and this is the program Radio Doctor, your free health consultation program where real doctors advise real people. And today I have Dr. Alozie Ndubuka with us, a medical director at St. Ives Family Hospital. All right, and he's consulting and advising on aging and health. All right, Dr. Ndubuka, so let's get on with it. So let's understand, or rather help us understand aging and health. Let's get to understand some of the risk factors that comes with aging as regards to our health. Help us to understand why we need to take our health seriously when it comes to, once we're getting older or now that we're young. Why should we take it, serious, so that once we start aging, all of these things that we're talking about, we'll only just be hearing them, but it might not just be affecting us as much because we are actually taking time to take care of ourselves. So help us understand aging and health. What's the correlation? What's the why should we take it serious? What's the importance? Just to give us an overview of this.
Yes, this aging is something that's very, very important, and you will agree with me that most people out there, most if not all, wish to have life long enough to become old. I don't think I've actually heard one-on-one anybody who says, "Oh, I want to die young. I don't want to get old."
Not at all.
So we all wish to get old, and it's also a wish we have for our loved ones. So you see a parent looking at his little child, his little 1 year, 2 year, 3 year old child. That parent, at the back of his mind, both consciously and subconsciously, is praying that one day this little child will be old. And another prayer which I use the word prayer because we are a very religious country, even if our people don't behave too well, but we are a very religious country.
Yes.
We still do a lot of praying. So one prayer which one other prayer which you have for those you wish to get old is you wish them a healthy old age. You wish them a healthy old age. Now, my mother, luckily, is still alive and doing well. And each time I see her, I feel so happy seeing her. And one of my most enduring wishes for her is to remain healthy and strong even as she gets older. So that is a wish we have for everybody. But the truth is that aging comes with its own health challenges. Yes, indeed, it's a gradual and continuous process of natural change.
Yeah.
So your body changes over time as you get older. And as you age, a number of things happen to your body which can predispose you to more ailments, more diseases, more challenges, and make you not to be as young as you used to be. Now, for those 20-year-olds listening to me today, I will bet you many of the things you can do today, like running, jogging, you may not be able to do those when you get to 90, if God grants you the grace to get to that. And that is natural, that is expected. Because as age comes, your body wears off, your body wears down, and so many challenges begin to happen. And these challenges happen to different aspects of your body. Different aspects of your body. Take, for example, let's even consider one or two things. Let's consider how age affects different parts of your body. I'm going to start today by looking first and foremost on the skin, which is usually the first thing people see.
Yeah.
When you see an elderly person, one of the first things you see that makes you recognize that this man or this lady is no longer young, is elderly. It's the wrinkles that you see on the skin. So why do these things develop? Now, wrinkles basically develop due to what we call photoaging. Photoaging. What happens as time goes on, as you grow older, is that your skin thins down. It becomes thinner and thinner. And the layer underneath your skin, what we call the subcutaneous layer, also shrinks. And apart from becoming thinner, your skin loses its elasticity. And by losing its elasticity, it's no longer able to stretch anyhow and return back to normal. When you stretch it, it takes time to return back to normal. So it becomes less elastic and more fragile. And as I said before, the fatty tissue below the skin reduces. If you've ever been into a theater or you've seen someone injured, you'll notice that when the skin is cut, there's this yellowish layer below it that contains fat. That yellowish layer below it that contains fat is one of the things that makes your skin look smooth. It's one of the things that gives you the beauty of youth. But as you age, this layer decreases. That fatty tissue starts decreasing, and the skin will no longer have a good foundation upon which to rest. And the consequences of it is that you tend to bruise, you tend to get injured more easily. Your body, your skin also will produce less oil. People do not know that there's something called sebaceous glands on our skin that produces oil, that oils our skin. And that is why even when you go out without rubbing a cream on your body, as the day goes on, you notice that particularly the skin of your face may become oily. It is because your body's glands are producing oil. Now, these sebaceous glands underneath the skin also die off as you age. And with this dying off, the natural oil which makes your skin healthy reduces, and because of that, your skin becomes dry. So with this drying and the wrinkles and the various spots that could appear on your skin, the elderly, when you see the elderly, you know this person is elderly. And all these changes on the skin also makes the skin more susceptible to infection. And such elderly individuals tend to get more skin infection as they go on. Now, things like the teeth also get affected. As you get older, the gums holding your teeth pull back. They are no longer holding onto your teeth as strong and as well as it should. And as a result, your teeth tends to be more likely to fall off. More likely to fall off. And even your salivary glands no longer produce as much saliva as possible. We all have saliva. One of the things saliva does in your mouth is it lubricates your mouth. It makes it easy for your tongue to move about as you speak. It makes it easy for your mouth to be healthy. The production of saliva makes the inner area of your mouth to be safe for you. It reduces the chances of bacteria and other infections taking hold in your mouth. So when this saliva production reduces, it predisposes you to having infections of the mouth. And it also increases the chances of your teeth falling off and decaying. And these are some of the things we find in the elderly, particularly. In the elderly also, most elderly people, you would notice, find it difficult particularly seeing near objects, reading, for example. Now, what happens is that the eyes have this special part called lens, the lens of the eyes. Now, as you age, the lens of the eyes tends to become that they tend to lose their elasticity. They tend to become more, we can use the word frozen in place, so that they are unable to accommodate, they are unable to shrink to make you see near objects. And you tend to have what we call presbyopia. And such an individual will tell you that he has difficulty focusing on objects that are close by. Then also, there are, another problem with aging is that the pupils, which allow light into the eyes, do not contract to regulate the amount of light that can enter the eye. And one of the effects of this is that it causes the individual to be quite sensitive to any sudden light on the eye. So the individual is unable to adapt to different levels of light within the environment where he is staying. And the elderly, for this reason, are more prone to develop things like cataract in their eyes, which simply means their lens being clouded. They are also more likely to develop glaucoma. Glaucoma is increase in the intraocular pressure. That means increase in the pressure within the eye. So, and these are some of the things age predisposes the elderly to. Then, when you think about memory, we all know that the older you get, the more likely you are to forget certain things. Your memory is no longer as sharp as it used to be. And your thinking skills are also affected. And it's relatively common seeing the very elderly sitting at one place, even in public, and dozing off. That is one of the consequences. I remember watching a documentary once about some of our very elderly African leaders sleeping at the international fora that are discussing things of particular interest to Africa. And these men were there sleeping up because, men in their 80s and 90s trying to rule a nation, they won't be as effective as a 40, 50-year-old who is in the same position. So these are some of the things. Remember the popular saying that you can't cheat nature. Nature matches with time, whether you like it or not. You can't cheat nature. But you can encourage nature to be kinder to you by the type of lifestyle you live. We are going to talk today about some of the things you can do to make your time when you are old to be more healthy and to be that's richer for you. So now, one other thing which we must consider here as we talk about aging is a problem I tend to hear a lot about. A lot of elderly patients tend to complain about this, and this is their urinary habits. How they will tell you, doctor, I'm always feeling pressed. Doctor, I always run down to urinate. Doctor, I sometimes wet myself. Why is this so? It is so because when a person gets older, the person's urine bladder tends to become less elastic. And when it becomes less elastic, the bladder cannot expand to accommodate more urine. And because of that, such an individual would need to urinate more often. Then also, the bladder muscles over time get weaker and weaker. and pelvic floor muscles also get weaker. And this makes it more difficult for you when you go to urinate. It makes it more difficult for you to even empty the bladder. So the person might be there in the toilet, finish urinating, and come out, and still there's urine still in his or her bladder. And this presence of urine in his or her bladder makes it necessary for him to run back again to the toilet to go and urinate. Then don't also forget that because of inability to control the muscles of the bladder, which is one of the consequences of getting old, such a person could have what we call urinary incontinence. That means when the urge to urinate comes, before he or she is able to get to the toilet, he's already passing urine on himself. I remember some years ago, I had this patient who brought his elderly mother, and he wasn't from the way he was speaking, he was angry with the mother. That why? That she's always smelling of urine. That can't you take care of yourself? That why must you urinate on yourself? And I had to caution him. I told him, I said, no, it's not her fault. It's not her fault. She's getting old. Listen, your mother is in her 90s now, and her bladder muscles are weak. When you get to that level, you might be worse than her. So I had to educate him on what this lady was going through. And after listening to me, he was able to better appreciate the challenges the mother was facing, and was able to see that it was not her fault, but it was a consequence of aging. And all these things I'm pointing out, all these drawbacks of aging, there are ways to medically handle it, and which is why at the end of today we are going to talk about those doctors that tend to focus on the elderly. These doctors are called geriatricians. So geriatric medicine is a very, very important part of medicine. And from my experience working in Nigeria, I have seen that it is an area of medicine that tends to be neglected a lot by people. Most of our people, when you have an elderly parent or elderly uncle or aunt, the tendency is to send the person back to the village and abandon him or her, and that is very wrong. When you get old, that is the that is the time when you should visit your doctor more often. So I encourage all listeners, if you have an elderly loved one, please take him or her regularly to the hospital to see his or her doctor. In age, as long as you're getting old, that saying that prevention is better than cure holds very true. It holds very true. And that saying that a stitch in time saves 9 also holds very true, because when you go see your doctor, when you take your elderly loved one to see the doctor will be able to advise you on how to ameliorate some of the challenges that the elderly person is going through. One other very, very important thing which people add, and this I say this before I yield the floor to you. One thing which many people will tell you, my old mom or my old dad is always complaining of pain on the knee, pain on the hand, pain on this, pain all over the body. This is a common complaint, and the reason for this is that with age, the bones of the body tends to shrink in size. And that is true. As you get older, your bones shrink in size and density. And this shrinking tends to weaken them and make them more susceptible to fractures. The joints also undergo changes, which makes it more difficult to move the joints. Then in addition to this, the muscles which control the movement of these joints also lose strength and endurance. And all these combined predisposes the elderly to such joint problems like arthritis, particularly osteoarthritis. So such people tend to have problems moving. They tend to have pains on their joints, and because of that pain, they are more reluctant to move. And being more reluctant to move now makes the pain even worse. So it becomes a vicious circle, and such a person, you notice such a person's gait will be unsteady. Such a person's gait will be less ably coordinated by the person, and that is why you see many elderly tend to use walking sticks to help them balance. So these are some of the challenges of aging. But aging is a lovely thing, it's a nice thing. It is something which, if you start planning for it now, especially with regards to your health, you will enjoy. And it is something which we all pray to have. I always jokingly tell my children that I would like to be around till 90-something. That if I get to 90, any day God calls me, I will go. And we all laugh about it. But the truth is that, yes, we all want to get to that age. We all want to get to. We want to get there. We want to get there without developing such common age-related ailments like cardiovascular problems, things like high blood pressure, things like atherosclerosis, things like heart problems with the heart, and all those which are more common in the elderly. So one thing also I must say here is that one of the things women in particular would have noticed is that in their younger days, that's in their late teens stroke, late 20s, between late teens and late 20s, the average woman tends to be at the peak of her fertility. That means she is able to get pregnant more easily. But as the woman gets into her 30s and progresses beyond that, she now notices that it's more difficult getting pregnant. And even when she does get pregnant, she notices that there's a higher tendency of miscarriages. So yes, you may not describe a woman in her late 30s and late 40s as elderly, but what this shows us is that the older you get, the more your body changes and the less efficient your body gets in taking care of itself. So as we go on today, we will discuss how you can take care of your body, how you can avoid some of these things which I have told you, or steps to take to ameliorate them, to get to feel better, so that you wouldn't be a victim of the consequences of aging.
Okay. All right. Thank you so much, Dr. Ndobuka, for giving us all of this, some of the common age related health conditions. You've mentioned all of it, and sometimes how we actually get to, get to see ourselves there. Well, this is Women Radio WFM 91.7, Nigeria's first radio station for women and their families. Thank you so much for staying with us all through, and of course, a very big thank you to Dr. Ndobuka, who has taken out time to explain the process of aging and some of the illnesses that comes with aging and why we actually have them. So we are definitely still on a Radio Doctor right here on Women Radio WFM 91.7.
Give malaria a double punch of Cortesonate and Amodiaquin, an effective combination that Camosunate. There's anti-malaria therapy. And you will bounce back to life. Comes in 4 different packs for different age groups. Below 1 year, 1 to 6 years, 7 to 13 years, 14 and above. Camosunator.
Emulsionate, effective anti-malaria for all ages. Marketed by Janet Pharmaceuticals Limited. If symptoms persist after 3 days, please see your doctor. Read the leaflet inside.
All right, you're welcome back to Radio Doctor, your free health consultation program where real doctors advise real people. This is Nigeria's first specialized health program where medical doctors consult for free and advice right here on Women Radio, WFM 91.7. So today is General Health on Radio Doctor and is supported by Janet Pharmaceutical. We have Dr. Alozie Ndubuka, a medical director of St. Ives Family Hospital, this morning talking to us and consulting and advising on aging and health this morning. My name is Rose Yusuf Kaiser and it's about 25 minutes to 11 right here on Women Radio WFM 91.7. So do well to call us up on 07000 917 917. Let's get your concerns, let's get your questions, let's get maybe that question that you have about your mom, your dad who is aging already or who's old and you're wondering why is this happening. Why are they always behaving a certain way? Why is this? Why is that? So sometimes you might not understand because it's age. So this is the right platform for you to call in and ask your questions. Okay, 07000 917 917 is a number to call right here on Radio Doctor. Before we go further to ask Dr. Ndubuka more questions on aging and health. All right, we'll lost that call. Do want to call us back on 07000 917 917. All right, so aging, Dr. Ndubuka has told us that it's something that we can't do without. We can actually jump that process. All of us have to go through it. At some point in our lives, we were young. Some of the things that we're able to do before, right now we can't even do them. So, but we all get there at some point. Hello, good morning.
Hello, good morning.
Hi, good morning.
Hi, good morning. You advocate also. I've been calling since.
Oh, thank you so much for calling.
I'm calling from. Yes.
All right, Tari, go ahead. Let's say, where are you calling from?
I'm calling from Bega.
From Bega, Tari from Bega. All right, Tari, go ahead. Let's hear you.
Yes, so thank you very much to our doctor. He has really given us some informative details on health issues for the elderly. So my question was based on the fact that I have a mom and she's having challenges with her leg presently. But before now...
With her what?
With her leg.
Leg?
Her leg.
Okay.
Her right leg.
Okay.
Yes. So before now, she's been having challenges with food intake. She stopped eating some certain kind of food. As when I was much younger, I never knew why she wasn't eating those things. Growing up, I discovered that the things she used to eat when I became an adult, when I used to know that, okay, this is my mom, those things she used to eat then, she stopped eating them. She stopped eating a lot of food. She stopped eating a lot of food because, according to her, whenever she eats these things, she gets the effect in her leg.
Okay.
So instead, she started preventing herself of eating those things. She can't take meat. Presently, she eats just a particular kind of soup. She can't eat rice. She can't eat gari. There are a lot of things I can go on counting that she cannot take in anymore because the moment she eats it, she gets the effect directly on her leg. So I don't know what the issue is. I would not be able to diagnose what the problem is. I would appreciate if the doctor can throw light on what he thinks we could do or what things could be the problem. Thank you very much.
All right. Thank you, Tari, for calling. Dr. Ndubuka, so did you get her?
Oh yes, I think I got most of what she said.
Okay.
But before answering her, let me start by commending Tari.
Okay.
I commending her for caring about her mom. I like people who care about their parents, because the truth of it all is that your parents sacrificed a lot for you when you were a child. And you won't really appreciate what your parents did for you until you become a parent yourself. When you spend sleepless nights thinking of the welfare of your child. And so when that parent grows up and that child is able to remember those sacrifices and take care of the parent, it's a good thing. And I commend Tari. That tells me that Tari was well brought up. Now, Tari has asked about challenges with the mom's legs and also challenges with her diet.
Yeah.
That she has, that she doesn't eat too well. And there's an easy way to look at this. Now, let's start with with her feeding. Now, one of the things that age brings about is that there are structural changes which occur as you get older in your intestines, particularly a part of the intestine called the large intestine. These changes increases the chances of such an older person becoming constipated. Now, one of the things you'll notice is that older people do not tend to get thirsty. The part of their brain that tells them you need more water, you need to drink more water, that part tends not to work as well as it used to work when they were younger. So an elder person who is dehydrated may not notice that he or she is dehydrated, and for that reason may not take enough water. So it is for those around them to encourage them even when they are not thirsty. Give the person water. Encourage the person to be sipping from time to time. Because in the elderly, when they don't drink water, their intestines will not have enough water to process what food they have eaten. So the little water that's in the intestine tends to be absorbed. The intestine will absorb it because the intestine wants to maintain the fluid within the body. And by absorbing it, it makes whatever stool that is being produced to become hard. And for this reason, the elderly is usually more prone to constipation. Also, don't forget that the elderly, for reasons of pain of the joints and pain of the body, they tend not to walk around too much. They tend not to exercise more. And by not exercising, food in the intestine doesn't get propelled forward. So this elderly person now gets constipated. And when the person is constipated, that means food is not moving through the intestine towards the rectum and outward. And this creates a false feeling of being filled. So the person, the elderly individual, because his or her tummy still has food in it, food that has not been taken out through defecation, that elderly person feels less likely to become hungry. So the food swells up the intestine, and the intestine tells the brain that there's food in me and I'm not hungry. And because of that, there will not be that urge to eat. So how do you take care of that? The first thing I would tell Tari is encourage your mom to take plenty of water.
Okay.
Encourage her. When I mean encourage her, gently encourage her. Do not bully her into taking that. Encourage her to take plenty of water. Also, encourage her to take a lot of fruits and vegetables. Fruits and vegetables form what we call roughages in the intestine, and these roughages helps prevent constipation and will help her go to toilet. When she goes to toilet, her intestines will become empty, and her brain will be able to notice that her intestine is empty, and the hunger centers of the brain will now encourage her to eat. So also make sure that whatever food you are giving to her has a lot of fiber. Of course, vegetables have fiber, and also grains have fiber. So give her whole grains, give her vegetables. This would make eating easy for her. Then encourage regular physical activity within her. And how do you do that? Get her to walk around, within the house. You can take a walk with her within your compound or within inside the house. This will help her generally with regards to her feeding and others. Then when she feels like going to the toilet, encourage her that she should go to the toilet. One of the habits which elderly people tend to form is that they tend to hold their bowels. They tend to hold going to toilet. When they think of standing up to walk down to the toilet, they will hold onto the feces within them, and that encourages the feces to become hard. So encourage her. Even if she's not feeling like defecating, let her form a habit of going to the toilet, sitting on the toilet seat for at least once a day.
Okay.
When she forms that habit, her body will learn from that, and she will start passing physics at least once a day.
Okay.
Then with regards to her legs, remember one of the things I mentioned earlier on is that as a person gets older, the joints of the person that experiences the consequences of aging. And one of the consequences of aging is that over time you have used these joints. Some people over time may have even abused the joints by their lifestyle. So an older person is more likely to have inflammation of the joints, inflammation of the bones, and all these can cause pain of the legs. Don't forget also that I had mentioned that with age, the bones of the person tends to shrink in size and density.
Yes.
And this shrinkage weakens the bones, weakens the bones, and tends to cause more pain. So how do you handle that?
Okay.
Try and give your mother food that is rich in calcium.
All right.
Try and take your mom to the hospital. Let the doctor listen. One of the things the doctor will do when you get to the hospital is the doctor might prescribe supplements of calcium tablets. The doctor might also prescribe vitamin D tablets and other things that will help. I want to discourage you from self-medicating because the tendency of most Nigerians is you run to the pharmacy and you buy drugs. When you are giving your mom these calcium and vitamin D supplements, do not do it on your own. Do it only with the guidance of your doctor, because your doctor would have a look at your mom first of all, and by having a look at your mom, he or she would be able to decide the quantity of drugs your mom needs to replenish the calcium she has lost over the years, and also vitamin D, which will help the body utilizing this calcium. And then also encourage your mom as much as possible to walk around. Walking is a weight-bearing exercise, and this will help your mom's bones to become stronger. When you sit at one place for too long, your muscles and your bones get weaker. But when you move about, your muscles and your bones get stronger. Why do you think athletes and sports people do a lot of exercises? It is to make their bones and their muscles stronger. And the same principle can be applied to the elderly. When you encourage the elderly do some exercises, it will make their bones and their muscles stronger.
All right.
So that is it. And for you, Tari, and indeed any other young person walking that's listening to me now, I would encourage all these things. You start now, start training your body for that old age. And one of the things you can do to help you age better is, one, you avoid smoking. Avoid smoking. Smoking makes you get older more easily.
Alright.
You limit the amount of alcohol you take in. And as much as possible, if you can even avoid the alcohol entirely, the best for you. So once you observe all this, you will notice that you age with grace. But before I yield to you, let me say something generally.
Okay.
It is true that certain factors can actually make you tend to age more than your peers. I have a number of friends who are about the same age. But when you look at some of them look older than their age mates. And this is because of several factors throughout their life. Factors like hereditary, that's heredity. Factors like lifestyle. Factors like exposure to toxins within the environment. And factors like availability of that's healthcare to such a person. Now, if we are to take lifestyle, for example, just like I mentioned, just like I told Tari, avoiding smoking, not abusing drugs and alcohol,
All right, Doctor.
maintaining a healthy weight and diet, and regularly exercising.
Okay.
If you do that right from your youth, you will not age as fast as your age mates.
Okay.
You will still look healthier and indeed younger than your age mates.
All right.
Factors like hereditary, some people have in their genes those genes that tend to age, that tend to make them look older than their real age. Heredity really can be changed per se, but one thing we have seen is that when you live a good lifestyle, even if your genes, if you come from a family that tends to age fast, you will do better than your siblings.
Okay.
Then exposure to environmental toxins, things like even excessive exposure to the sun can make you age faster and can make you suffer the consequences of aging more than your age mates. So
Alright.
you'll be careful about your exposures. Then finally, it's very important for you to go see your doctors regularly. Those who visit the hospital for regular checkup tend to age better than those who do not.
Okay. All right. Thank you so much, Dr. Ndobuka.
Give malaria a double punch of Cortesonate and Ammonia Queen. An effective combination that Camosunate. There's anti-malaria therapy. And you will bounce back to life. Comes in 4 different parts for different age groups. Below 1 year, 1 to 6 years, 7 to 13 years, 14 and above.
Camosunate, effective anti-malaria for all ages. Marketed by Zenith Pharmaceuticals Limited. If symptoms persist after 3 days, please see your doctor. Read the leaflet inside.
All right, yes, you're welcome back to Radio Doctor right here on Women Radio WFM 91.7, and today we are looking at aging and health, all right, with Dr. Ndobuka. All right, so yes, my name is Rose Yusuf Kaisa. We just have a few more minutes to go on the program this morning, and general health on Radio Doctor today is supported by Zenith Pharmaceutical.
Give malaria a double punch of Cortesonate and Ammonia Queen. An effective combination that Camosunate. There's anti-malaria therapy. And you will bounce back to life. Comes in 4 different parts for different age groups. Below 1 year, 1 to 6 years, 7 to 13 years, 14 and above. Camosunate.
Camosunate Camosonate, effective anti-malaria for all ages. Marketed by Janet Pharmaceuticals Limited. If symptoms persist after 3 days, please see your doctor. Read the leaflet inside.
All right, thank you for staying with us right here on Radio Doctor. So this caller has been very persistent and our time is fast spent. So I will just pick this call and Dr. Ndubuka will just use 1 minute to answer this person. Hello, good morning.
Good morning, sir.
Good morning.
Hello, sir.
Yes, he's with you. Please go ahead. Bring down the volume of your radio.
Thank you very much. God bless you.
Amen.
All what doctor said, all what the doctor said ran with me. I'm very grateful. God going to help you.
Amen.
I have most of this complaint, but it's exercise. I'm subduing them. I'm from medicine and using, I'm subduing them. Is there any general medicine the doctor can please recommend to do more relief for all this type of things? I'm 80 plus, about 5 or 6 months.
Okay.
80 plus. But we want all the doctors to rise with my condition.
Okay.
This is the bone, the arthritis, the problem, this and that. Is there any medicine the doctor can still recommend to subdue most of these things, please?
All right, what's your name and where are you calling from?
Odulana is my name. I'm coming from a caller.
Okay, all right.
That's the connect area.
All right, thank you very much for calling. All right, Dr. Ndubuka, did you hear our caller, the last caller?
Oh, yes, I did, but I didn't get his name. What's the name?
Olubukola.
Oh, okay. No problem. Now, he said he's 80, 80, and I commend him for his wisdom of knowing the importance of exercise. And I'm happy that he's been exercising, which is a very good thing for him. He has also asked me to recommend a drug which he can be using. I have to apologize that I'm not going to be able to do that because it's not ethical to recommend drugs on air to people randomly. It's not proper medical practice to recommend drugs on radio. But I would encourage this 80 plus year old gentleman who called to please see his doctor.
Okay.
There are so many drugs, so many tablets, which are mostly vitamin based, that the elderly can use to help as they grow older.
Okay.
So he should not hesitate to go see his doctor. For checkup and for the drugs to be recommended. And I encourage him also to please continue living a good life he has been living and exercising. Okay.
All right. Thank you so much, Dr. Alozie Ndubuka, for being a part of our program today.
Thank you for having me today.
With you.
An interesting week.
Honestly, it always seems as if it's not enough with you. All right. Thank you so much for coming on. And have a great day, too.
Thank you for having me, and same to you. You have a lovely day.
All right, thank you. All right, so that's much we can take today on the program Radio Doctor. Do want to join us again tomorrow, right here on Women Radio at 10 for the program Radio Doctor. General Health Today is supported by Janet Pharmaceutical. My name is Rose Yusuf Kaiser. Do have a blessed day and stay with us right here on Women Radio WFM 91.7. Good morning.
Give malaria a double punch. Tesonate and ammonia queen. An effective combination that Camosonate. There's anti-malaria therapy. And you will bounce back to life. Comes in 4 different parts, 4 different age groups. Below 1 year, 1 to 6 years, 7 to 13 years, 14 and above.
Camosonate, effective anti-malaria for all ages. Marketed by Janet Pharmaceuticals Limited. If symptoms persist after 3 days, please see your doctor. Read the leaflet inside.
When great minds meet, great ideas inspire and transform a great nation. Wherever you are, National Advertising Conference is calling.
So, join us. Let's share perspectives on how brand narratives are developing talents, inspiring alternatives, and supporting a more creative economy. Theme: Marketing Communication as an enabler of national transformation.
Yes, Abuja will be on standstill from December 6th to 8th, 2023. Venue: International Conference Center, Abuja. Time: 9 a.m.
WFM 91.7.